This is the voiceover presentation for plyometrics. So you should have your open outline. It should be about 3 pages. If you don't have it, it can be found on Moodle and you can download that and complete that while you're watching the video. So to start off, we define plyometrics as a move towards some sport-specific activities. So we're starting to bring the athlete back to functional status. They're kind of moving out of the formal rehab. So bringing them in to sports activities. Plyometrics were first called jump training, and again, it helps bridge the gap between strength and explosive power, which is required for most sports. Plyometrics aids in training the body for rapid starts and stops and quick changes in direction, sudden reversals, from acceleration to deceleration, and being able to perform them automatically, economically, and then efficiently. So our goal with plyometrics is really power production. That's what we're trying to train back. So when we look at the definition again, we could write down this under definition of plyometrics. It's quick lengthening followed by shortening a muscle to produce a powerful movement. Maximum strength output is what is desired and as quick as possible. We're also using plyometrics to heighten the excitability of the nervous system for improved reactive ability of the neuromuscular system. Plyometrics can be performed in the lower extremity, the upper extremity, and also the trunk. However, usually in rehabilitation, we're using them primarily in the lower extremity. We've already talked about core. We've had this lecture already, but make sure that the athlete has adequate core strength because that must be established and is vital prior to initiating any plyometrics. So within plyometrics, we will have 3 phases. The first phase is an eccentric phase, and that's kind of our preparation. It's a stretch phase in which the rate of stretch is more important than the amount. So it's best if it's quick through a partial range of motion, which causes the muscle spindles to respond with a reflexive contraction. The greater the eccentric activity, the greater the concentric response. The second phase of a plyometric is the amortization phase. It's the transition or coupling phase. It's the time between the eccentric and the concentric, and it must be short in order for maximum force to be produced. Otherwise, our elastic energy is wasted from the muscles, and the stretch reflex from the muscle spindles is also inhibited. Then the third phase would be the concentric phase, which is also known as the outcome phase, and that's the concentric contraction. Force and speed production can be increased through practice and neurological facilitation. So we practice plyometrics, and of course speed is very important, especially in that amortization phase, in order for maximum force output. So the greater the eccentric activity, the greater the concentric response. The athlete becomes more efficient and coordinated and will be able to produce more power. Now, before an athlete begins plyometrics, it's really important that they're ready to begin plyometrics. So there's certain prerequisites we want to have met. The first one that I have on the PowerPoint says the obvious. They should have normal range of motion for the joint that's been injured or that's in question. It's recommended that they're older than 16 and that we don't have any of the contraindications, which we'll address later in the lecture. But in short, right now, they don't have acute inflammation, they aren't post-op, and they don't have instability of any of the lower extremity joints. Again, plyometrics can be done with upper extremity and core as well. Most of our examples will be of lower extremity, though. So in preparation for plyometrics, they have to have the obvious prereq, and then second would be strength. That's number 1 on your outline, but they have to have enough strength to adequately control the activity, and greater strength allows better performance and minimizes the injury potential. So one landmark that we can use to test this is by having somebody do a power squat. So they should be able to power squat 60% of their body weight, 5 repetitions in 5 seconds, in order to begin with moderate or high-level plyometrics. And that would be plyometrics that are above like a jump rope. training. So if they fail this, they need to go back and work on their strength. It can be retested then so that they can progress their plyometrics into moderate and high level. But again, if they fail, they can do some low-level plyometrics such as jump rope or just floor tape jumps, and we'll talk about those in a minute. For upper extremity, they should be able to perform a regular push-up. There's no specific requirements other than that have been stated that I know of. Second prerequisite for plyometrics then would be power. And again, this is in order to start moderate to high level plyometrics. And we're going to define those later. It has everything to do with number of contacts per session. So when we're talking about low intensity plyometrics, it's like 60 to 100 contacts per session. So they can start those, but they aren't going to get a lot of gain as far as functional return to sport. So our second one, power prerequisite, is that they should be able to do a standing single leg long jump, a distance that is 85% the distance of their uninvolved side. So we'll take an average of 2 or 3 trials, and then we'll take the best of that, divide it by the distance that they get over their average of the involved side, and then multiply that by 100. So that the injured has to be able to do 85% of what the uninvolved side. So I guess the PowerPoint here says 85% of the involved side. That should be 85% of the uninvolved side. Of course, that makes more sense. You could also test a standing long jump for distance, and that has to be equal to the individual's height. And if they meet that, then they can also start moderate level plyometrics. For the upper extremity, they should be able to do a medicine ball toss. There are different types of medicine ball tosses. There is no minimum amount here that I've seen. So if they can do a 3-pound medicine ball toss, then they should be able to do plyometrics with a weight that's lower than that. The third plyometric, or the plyo prerequisite, would be flexibility, and they need to have a greater flexibility than maybe a little bit more than what's required for their sport, so they have a range to work in. But greater flexibility provides for improved force production and force absorption, and so we certainly need it within a normal range of motion for the sport, which can vary, of course. The greater flexibility provides an increased level of force absorption, and again, to help decrease injury. The fourth one on your sheet is proprioception, which we just finished the lecture on that, which is a combination of agility, balance, and coordination. It helps provide control and accuracy when plyometrics are being performed. The static test that is typically used is that somebody should be able to do a single leg stance for 30 seconds with their eyes open, and if they can complete that, then they can start low-level plyometrics, and then based on how they perform the low-level plyometrics, they will gradually increase. If they tend to, when they're doing their plyos, they have an increased movement in one particular direction, it might be a good idea to assess the strength of the muscles that are on the opposite side. So if they tend to land and they're always drifting forward, they're always falling forward, it might be a good idea to assess the gastroc strength, which really should be contracting to help pull their bodies back or posterior if they're balancing using ankle strategies, or perhaps looking at the trunk extensors and the hip extensors if they are using primarily hip strategies to maintain their balance. So then if they've met those, we can start moving the athlete into plyometrics, and the design involves in general 3 guidelines. The first one on program design is to move them from general exercises to more sport-specific activities. So depending on what their sport requires would dictate what plyometrics that one would do. Certainly there wouldn't be a need for a lineman to do a 12-inch box jump. That's just not required for their sport. That time would be better spent doing something else. Number 2 on program design is to think of moving your plyometrics from simple activities into complex activities, and I'll give you lots of examples towards the end of the PowerPoint on how to do that. And then from low stress to high stress, if indeed high stress activity or plyometrics are needed for that sport. There's some variables that we can kind of manipulate when we're designing our program in order to get more complex or increase the stress of the activities. And these 4 variables are listed there. The first one is intensity. So in order to manipulate the intensity variable with plyometrics, we can add weight onto a limb. So we think of moving somebody from double leg stance into a single leg stance. We could increase distance, and that could be vertical distance or it could be horizontal distance. We could have an increase in speed that's required or an increase in complexity of the plyometric drill. All of these would increase intensity for that particular drill. Another variable that can be addressed when somebody's doing plyometrics and we need to make it more complex or more challenging is to change the volume number. And this is really where we start to say, is this a high level or a low level plyometric session? So we're going to count number of foot contacts per session. And we actually do count how many times the lower extremity, the foot, hits the ground. So low intensity or beginning plyometrics, it consists of 60 to 100 contacts per session. Moderate is somewhere between 200 and 250 contacts per session, and then high level volume would be above that 250. Of course, we can change other things about the plyometrics, not just the volume number, but how high they're going. So we could address volume number and intensity. Typically, though, it's better just to change one variable at a time. In case we have problems, we know which variable was the culprit. Third variable we could address is recovery time. So if we have an athlete that's working more on power with their plyos, we might give them 45 to 60 seconds of recovery between sets, so they have more of a 1 to 5 work to rest ratio. So if they work for 10 seconds, then they get 50 seconds of rest time. And that can be moved all the way up to a 1 to 10 ratio for work to rest time, depending on how difficult the actual plyometric is. If we want to work on endurance, we're going to decrease that ratio of work to rest time to more of a 1 to 1 ratio or a 1 to 2. So they might spend 10 to 15 seconds performing the plyometric, and then they get 10 to 15 seconds of rest. Now obviously with a ratio like that, you're going to have to decrease the intensity of the plyometric in order for them to be able to recover in just that same amount of time, whereas with a power plyometric, the force production is much greater, and they're going to need that extra 45 to 60 seconds to recover after that plyometric. The last one variable that we could address is frequency. However, there are some parameters that we want to stick to. It's suggested that 48 to 72 hours are given between sessions of plyometrics, intensity being the primary factor as to whether that's 48 or 72 hours. It's recommended there's no more than 3 plyometric sessions per week in preseason, and no more than 2 times a week during the in-season sessions with an athlete. As we move on to plyometric program considerations, there are some other things that we'll want to keep in mind when we're designing plyometrics, or maybe even just for the first few times you're just picking out which plyometrics an athlete should do. The first one is age. We want low intensity, low volume for prepubescent patients, so that 8 to 13-year-old. And it's been suggested that plyometrics are limited to athletes that are 16 or older if they're moving into a moderate or high level plyometrics. I remember in volleyball in high school, so at age 15, 16, I was required to do 12-inch box jumps during our summer training, and I remember they were just too difficult. They hadn't ramped us up into that ability yet. We physically weren't mature enough. We didn't have the ability to maintain balance, and I remember several days coming home from doing box jumps and having the fronts of my shins were just bleeding down the front of them because I'd skimmed them on the way either going up onto the box or coming off the box because I'd gotten so fatigued. So that program consideration is one that I personally adhere to. So under the age of 16, I don't think there's a need for moderate or high level plyometrics. Body weight is a consideration. Increased body weight can stress the tendons and joints, and that might be too great in order to do safe participation for plyometrics, especially if we're talking about a heavy patient, which is defined in athletics or with plyometrics as someone that's over 220 pounds. So carefully pre-select these plyometrics on this part. Next program consideration would be the competitive level. Competitive patients are more appropriate candidates for moderate and high-level plyometrics than recreational. So I don't know in the future how much you'll be working with recreational athletes, but plyometrics would be pretty low on my list as part of rehab for a rec patient. Unless, I mean, it would have to be some special circumstances, I'll just say that. So if I do need to work with plyometrics, it's going to be low level. So surface is a good thing to look at. We want to use probably more yielding surfaces, grass, mats, spring-loaded floors like a gym floor, not the SRC with shock-absorbing qualities that are a little better than, well, quite a bit better than cement. But it shouldn't be so soft that it impedes the concentric phase, especially if they're doing high-level plyometrics, because there's too much absorption and they can't get a good push-off. We don't have enough ground reaction force in order to get a good plyometric. For footwear, should be supportive, provide some shock absorption. You might have to check the foot biomechanics before beginning this. We're going to go into a whole session on checking subtalar neutral and foot biomechanics in our ankle and foot lab coming up here in a few weeks, so you'll have more information on how to do that properly. Proper technique, there's 4 suggestions that are written in your notes that you could look for, or at least at very minimal teach athletes. Number 1 would be midfoot landing position and then to push off on the balls of their feet. I have yet to see an athlete that lands on their hind foot, so I don't think that that's a problem. Number 2, keep the trunk upright. Typically the weaker athletes will want to come into more of a forward flexed position, and they have difficulty keeping their trunk upright and might have to go back to doing some core training before they start some plyometric. Number 3, stop when it gets sloppy. We want to enforce good practice, quality practice that would enhance good engrams. So again, kind of back to that practice perfectly, and when it gets sloppy, just give them a rest. And then make it as sport specific as you possibly can. And you'll continue to hear that as we start wrapping up or getting closer to the end of rehabilitation phases, which plyometrics, we're getting really close to the end of rehab, moving the athlete back into sport. And then the goals, it's a good idea to take some pre-plyometric tests, maybe how many box jumps they can do on a 4-inch box in a certain amount of time, and then reassess them weekly or maybe bi-monthly to see if they're improving. It not only is good documentation and supports that your athlete's getting better, but the athlete can see in numbers that they're improving. As far as precautions and contraindications, these are pretty obvious. For the precautions, number 1 is time. This is in regards to length of session. So keep them short. Keep your plyometric training towards the front end of your rehab session. So we wouldn't want to go through and do a lot of strength training and all their other exercises, and then put plyometrics at the very end on the last thing that they do. So I'd keep it on the front end. And then DOMs, I just warn them that they're going to have probably some delayed onset muscle soreness when they're doing a lot of this eccentric and quick activity. But if they have DOMs in the muscle, and it wasn't the muscle that was primarily injured, that's fine. But if they have inflammation of the joint, then we need to back off. Contraindications are pretty straightforward: acute inflammation of the joint, postoperative conditions, and we're talking about fairly recent post-op conditions, and instability. So, equipment that you might be utilizing when you use or set up plyometrics, it could be anything from cones to boxes, hurdles, medicine balls, jump ropes, stairs, all sorts of ideas. The last section in this PowerPoint is just a picture of all the lower extremity plyometrics that are listed in your sheet. So there's really 6 levels of plyometrics. And then there's some examples of each. So this level is jumping in place. It's the lower level of moderate level plyometrics. So you could have somebody jumping in place, just doing a 2-foot ankle hop. And the next one in this phase would be a hip twist ankle hop. So twisting one direction, landing, and then coming up and twisting the other direction, and then landing. The second phase would be standing jumps, so things like standing long jumps, is pictured here, standing and jumping over a barrier, and then doing a standing long jump followed up by a sprint. So really these are only limited by your imagination. So if you have other ideas that you've seen done with athletes, or that you've done yourself that you like and think are particularly effective, go ahead and try those. Again, we're looking for sport-specific activities. Single leg hops is an example of when we talk about multiple jumps and hops. So we've got single leg hop. We can move into stadium hops, which are significantly more difficult. Next category is bounding, and then skipping. Again, we could work on height, so vertical or horizontal displacement. Box jumps, here's front box jump coming forward and then back down. There's pyramid box jumps. I particularly like these, going from one level to the next. And then sometimes I'll throw in maybe a twist, so they have a 90-degree twist every time they go to the next surface. So the next time this gal would land on the floor, she'd be facing us, and then she'd go back up onto the box and turn 90 degrees again to the left, so she'd be in the position that she's in right now. And then when she lands on the floor, she's facing me, or the screen, and so forth. So you can kind of mix it up, again, depending on the sport. Depth jumps, if this is required, we could do double leg depth jumps and single leg depth jumps, which are fairly difficult. If you've never done these, it might be a good idea to try 1 or 2, and you could do them on your own, see how they work. Upper extremity and trunk plyometrics, there's really only 3 levels. There's a medicine ball toss below 90 degrees, which would be like a chest pass, and there's medicine